Hey everyone, Dr. Elizabeth Hugger here with Lap of Love. This is my old girl Star. Yes, she is being bribed to be in this video right now. She's getting up there in years, but she's hanging in there. Now, I often hear from pet parents who hesitate to have their certain procedures done for their pets, whether it's a dental cleaning, a mass removal, or any other procedure that requires sedation or anesthesia. The common misconception I hear is older pets can't be anesthetized. But here's the thing, that's simply just not true. Yes, there are certainly some health conditions like severe heart or lung disease that make anesthesia riskier for some pets, but these are actually quite rare, and the key is weighing the risks versus the benefits. For example, if Star here had a tooth root abscess and the tooth needed to be extracted, you bet I would anesthetize her for that. Those can be excruciating, and removing that tooth would relieve her pain and allow her to enjoy life and keep chasing squirrels and barking at everyone that comes to the door, the mailman and anybody else. Now, before any procedure like that, we'd always do some preliminary blood work to check for underlying conditions like kidney or liver disease. It's not that those would necessarily prevent me from putting her under anesthesia, but we would take extra precautions like placing an IV catheter to ensure that she has IV fluids, ensuring she stays hydrated and safe throughout. On the flip side, Star also has a little cyst on her lower eyelid. Now, it's not causing any discomfort, it's not affecting her vision. If we were already anesthetizing her for something else like a tooth extraction, yeah, I'd absolutely have it removed at that time. But right now, it's not causing her any issues, it's not affecting her vision, so we're just keeping an eye on it. And that's what I mean by weighing the risk versus the rewards. There's not a big benefit to her quality of life by removing that at this point. I remember hearing in vet school a phrase that really stuck with me: old age is not a disease. And it wasn't until I started practicing that I really understood what that meant. It's just because a pet is older doesn't mean that they can't have the same treatment options or that they shouldn't get the care that they deserve. So age aside, always look at the big picture when considering your pet's health. Don't assume that just because your pet is senior that they can't safely undergo anesthesia. Make sure to have a conversation with your veterinarian about what's best for your furry friend.